Welcome everybody to our video where we would like to share our knowledge product with you. So we are Kilombo mobile app, Afro-Colombian Ancestral Medicine represented in digital networks. And we see this project as Afro-Female Leadership, crafting the future of e-health in Bogota. We are Julissa Mosquera, matrona of Kilombo Juma, and me, Laura Niño, systemic designer working with Kilombo Juma in Bogota, Colombia. So our product knowledge is an app, which we call Kilombo app. And in the next slides, I'll share with you the why, the how, and the what. So the why, very concretely, what we've seen is a historical and systemic segregation, racism, and extreme poverty of Afro-descendant populations in Colombia, but also in Latin America. In Colombia, particularly, Afro-Colombians suffer from generalized violation of their civil, political, economic, cultural, and social rights. Afro-Colombians are the most displaced population by our own civil war. Women are the most affected victims. Women also suffer from increased health inequity, particularly maternal deaths in pregnancy. These also happen to other ethnic minorities, such as indigenous populations. And of course, we think it's been enough. We want to stop this cycle. We also notice that these segregation and subordination also happens by macro systems such as the healthcare system or the municipality of Bogota, which decided to fund in 2014 6 Kilombo Afro-Colombian ethnomedical units in the capital of Bogota. And these funding of 6 Kilombos, which are now 10, came at a very high price to these ethnomedical centers, because what it meant is that they needed to start completing paper forms to be able to be audited on their practices. The sad part is that these forms do not reflect their practices, they don't reflect them. And these forms are inefficient, redundant, illegible, cumbersome, and there are way too many. So they're interfering with their practice to look after their people. Furthermore, the data that it is collected does not reflect their beliefs and practices. So they've been audited by things that they're not represented in, which is completely unacceptable. The data does not provide any insight to the personnel of Kilombo. So many times when they're asked how many people have you seen monthly, although they've been filling out questionnaires and data forms, they don't know, which is also completely unacceptable. The data should flow in both directions. And last but not least, the municipality asked them to complete, after the paper forms, data in Google Sheets in a desktop format, which also feels incredibly alienating and unfamiliar to their practices. So we want to change these, and in order to change it, what I've done as an anthropologist and a systemic designer who is part of Afnemo and Kilombo Juma, I began by understanding how they do things through a very thorough ethnographic research process. And then we have begun co-designing the app, making sure that they feel fully represented and all the richness of their practice is captured. Something also noticeable was the fact that all of them use mobile phones widely in their daily practices, and they're very familiar with some of these applications they have in mobile phones. Last but not least, before introducing the app, I would like to mention that the personnel of Kilombo reflects the richness of their practice, because we have ancestral midwives, we have healers, but we also have community health workers who understand how the healthcare system works and the paperwork required to get the financing from the healthcare system. They have an environmental technician that makes sure that people are living in okay living situations. We have a Western nurse who's been working there since the very beginning and before. Ancestral medicine embraces Western medicine and understands how they can complement each other. And last but not least, the matrona, the social leaders, the founders behind these very big, ambitious projects. So what we created as our knowledge product is a mobile app that actually combines ancestral and Western medicine practices of Kilombo. It reflects the linguistics, the graphs, and the visualizations are easy to follow and understand by them. The app empowers Quilombos through easy access and insight of data in real time. So now when they ask them, how many people have you referred to the healthcare system? How many pregnant women have you seen? How many children have you vaccinated? They can easily find it. And last but not least, we want to stop the paper form. They're nonsense. And Kilombo wants to be audited based on the data that they, where they feel represented. And so we created also as a way to engage in a conversation with public institutions to change the face of healthcare today in Colombia, to make it much more inclusive, and to make sure that these communities have the healthcare that they feel that they deserve and that they feel represented in. So we have created a two-way conversation, and we're very grateful about this opportunity. And we hope you keep on joining our revolution with our data. We hope we can have the proof points to get Quilombos to become part of the national policy of the country regarding healthcare. We want to institutionalize this Western and medicine, ancestral and Western medicine combined approach of Quilombos. Thank you very much for listening and joining us.